Hi, I'm Dr. Joel Cherdack. One of the most common class of peptides that we prescribe for patients in our clinic are called growth hormone secretagogues, or growth hormone stimulating peptides. And you may have heard names like Tesamorelin, Ipamorelin, CJC 1295, just to name a few. And one of the questions we often get asked about these peptides is, why would we prescribe a growth hormone stimulating peptide rather than just prescribe human growth hormone by itself, or what's called exogenous, or coming from outside of the body? And many anti-aging clinics have done this for many years. They've prescribed cycles of human growth hormone for people to take to increase their metabolism, increase their lean muscle mass, increase their strength, increase recovery, and improve sleep. So growth hormone has all of those effects, whether it's coming from outside of your body or whether your body's producing it naturally. Now, when you use a growth hormone secretagogue, or a growth hormone stimulating peptide like the ones that I've mentioned, what that does is it acts within your normal physiological range. So your pituitary gland can only produce so much growth hormone. It's going to have a maximum or a ceiling. And what we're trying to do with the growth hormone stimulating peptide is come close to that ceiling and have your body naturally producing as much as you possibly can. And also having it flow in the same physiological rhythm as it occurs naturally in your body. So, for example, your pituitary gland produces growth hormone while you sleep, after you exercise, and sometimes after you eat. And so it fluctuates up and down throughout the day. When you take growth hormone supplements by themselves, or human HGH exogenously, you're just increasing your blood levels of growth hormone over a long period of time. And that can have some negative side effects. Some of those side effects include what's called acromegaly, and you may have seen this with famous people like, for example, the baseball player Barry Bonds, where their jaw and their head will expand and grow, and their bones grow, and their hands grow in response to a physiological level of growth hormone that's way above what your body would be able to produce naturally. So we always like to prescribe these growth hormone stimulating peptides as part of our anti-aging and recovery protocol because of the safety profile, and also because, like I said, it flows with your natural physiological rhythm or timing of growth hormone release. So it's a much safer way to get the maximum benefit from growth hormone. So, like I said, some of the effects of growth hormone would be to increase lean muscle mass, to improve sleep quality, to improve metabolism, and to slow the effects of aging, and do it in a much more natural way than just prescribing HGH by itself. Now, there are situations where people have true growth hormone deficiency, meaning that their pituitary just can't produce that much growth hormone that's necessary to maintain those effects that I was talking about. In those cases, prescribing HGH by itself may be the best option. But in most instances, prescribing a growth hormone stimulating peptide is going to be the safest and most effective way to get the benefits of growth hormone without going above your physiological range and potentially causing some really negative side effects. So if you're interested in getting involved in our growth hormone stimulating peptide program, please click on the link on the bottom of the description of this video, which will take you to our homepage where you can request a free patient consultation. We look forward to hearing from you.